Okay, I just want to note, again, focusing on the equipment a little bit here. You can see in the video that I've got this handy dandy little bag. This little bag is capable of carrying pretty much everything you need for this examination. So what I recommend, and actually more than recommend, I feel that is absolutely essential, are 4 blood pressure cuffs, um, the Doppler transmitter itself, a 9-volt battery, some tape, your ultrasound gel, a pen, and a little calculator if you have one. I don't have one in this one, but it's always handy for calculating your ABIs. Your Doppler transducer with the proper protective hood, and the PPG with also its proper hood, which I just popped in here. So this goes on here like that, just to protect it. Now the way I have this organized is I've got all the wires sort of nicely secured here with the toe cuffs. So that keeps your toe cuff organized with your PPG, but it also keeps your wires intact. I'm kind of picky about wires because if you let them get all tangled up and knotted, they'll kink and the casing around the wires will become disrupted, and that could pose not only a hazard to you, but it could definitely interrupt your reading. So this blood pressure cuff here is a toe cuff, as you can probably tell. It's about it's actually a 2.5 centimeter cuff, which is quite large for a large toe. So the way you would measure it is the same way you would measure a blood pressure cuff appropriate for an arm. So I'm just going to show you that. Now the problem, though, I'm just going to say, is that they're not really long enough oftentimes for the really big fat toes. And I say that because if they don't go all the way around the toe, or if they don't overlap, or if they don't touch, like approximate on the edges, then it is really actually too small of a cuff. So that's how I kind of keep this organized. Now just to show you this arm cuff, this is a 12 centimeter cuff. Now this is generally for larger individuals, larger body habitus. The way you know is that the diameter of the arm should be about 80% of the width of this blood pressure cuff. And so you can kind of eyeball it by, this is about the diameter of the arm, and then if you, superimpose that little crude measurement over your cuff, that's about, one way you can eyeball it. But generally speaking, you're going to have about a 10 centimeter cuff and a 12 centimeter cuff, and the 10 centimeter cuffs are usually universally good for ankles and arms on slimmer people, and on larger people I'll use a 12 on their arms. So just so you know. So the only problem with this little bag is that sometimes we can't get 4 cuffs in here, but it is absolutely essential that you have 4 cuffs. One of the things that you're going to see in this video is that I've organized my time so that I'm kind of multitasking just to cut down on the length of time that I'm with the patient. And that's not because I don't like patients, I love them, but it's because it increases the reliability and validity of your examination results. And so let me just explain that for a moment. Oh, and I'm sorry, I forgot to show you that there was a sphygmomanometer also in there. It just caught my eye. So the reason why you want to ensure that this examination is done within an appropriate time frame is because, first of all, it limits their anxiety, increases their comfort. Another thing is that they won't get too cold. We really want the patients to be warm and very comfortable and relaxed. Another thing is that their physiology changes surprisingly fast. And what we need to make sure is that we're correlating our blood pressures with our baseline. So we take our blood pressures of the upper extremity as the baseline to compare our ankle pressures to. So it's really important that you have them within a timely time frame. So if you have 4 cuffs, then it takes away that delay of taking off a cuff and putting them on the other arm and then putting them on the ankles. So, so that's why it's very important. If you don't have four cuffs and you are moving the blood pressure cuff around, you're going to find yourself getting a little bit frustrated with your pressure's not really correlating, and you're going to have to redo pressures, and it just lengthens the time of your examination and causes a lot of frustration for everyone. So that's what has to go into your handy little bag.
Well, that's good. So, have you ever had any problems with the circulations in your legs?
Not that I'm aware of.
No? Okay. Have you ever had any problems with your veins? Any varicose veins? Any kind of problems like that in your family or with yourself?
Oh, my mom did. I remember her having an awful lot of problems with that.
Oh, with varicose veins?
Yes.
And did she have any sores on her legs or any...
She did.
Yeah.
And they were really hard to heal.
Mm.
I remember working on them a long time.
Okay. What about any arterial history with yourself or your family? Have you ever had a chest pain, heart attack?
I did about 2-3 years ago.
Oh.
I did have a heart attack.
You had a heart attack? Did you have to have an operation for it?
Yeah.
Did it happen just as you woke up? And
do you know, I remember saying it just...
Okay, and for a number of years, or?
Yes, but...
Sorry, I'm fast forwarding a little bit.
It's good to make sure that you take it under advisement from your physician.
These are parts that you can watch on your own. I just wanted to...
And even if it goes or anything like that.
Okay.
Well, that's good.
So now I'm going to actually start the examination part.
This is mostly, in which leg are you having the most problems with?
The left.
So one of the things here is that I don't recommend you not wear gloves. I was watching this with, actually I had a guest speaker on Saturday who was going to co-host with me on that recording, and then the recording didn't work. So anyway, she was watching this with me, and we were both kind of aghast that I didn't put any gloves on. So I wanted to bring that up. In any of these teaching videos, there's always going to be some room for improvement. So if you see any other mistakes, and there are a few in here, I would really like to hear from you what you find. So anyway, I would recommend gloves at this point. Now pulses, lots of people don't take the pulses because you're going to do the Doppler analysis anyway. However, in some cases I've found that people prefer to take the pulses just to have a landmark for where they're going to place the Doppler. And so they find basically they're finding their best Doppler window.
Yes, they do. Good. Your toes look good. Okay, and I certainly don't see any sores or anything like that. And I can just see that one scar there from your surgery. Okay.
Okay, be careful about scars. I always look for scars on patients' legs because sometimes they've had vascular surgery on their legs. If they have had previous grafting that goes down into the ankle, you can most definitely not put a blood pressure cuff over it. The way you kind of tell the difference is if they have, a scar along the course of where the saphenous vein is in the leg, plus they have scars around on their chest. They've probably had coronary artery bypass grafting using the saphenous vein as a harvest graft. So, but hopefully your patient can give you that information as well.
So, Mrs. Bolin, I've got all of my equipment out. It's really very simple, isn't it? What I've got here it's called a Doppler, and it emits sound energy. So it's just like an ultrasound, like when ultrasound technicians look at babies. So that's the type of energy that goes into your body. And this is what is going to be noisy. This one is called a photoplethysmograph, and it will go on your big toe, because what I want it to do is give me a reading of your arterial flow in your skin at your toe. And the type of energy is infrared light. So both of these energies are not at all toxic to your body, or they won't harm you in any way.
So just a quick note about PPGs. I have heard quite a few people refer to PPGs as what they're calling it PPGs, but what they mean is toe brachial indices. So be aware of your terminology. I think we need to all get on the same page in terms of PPG being the instrument and the TBI being the calculation, the ratio between the arm and the toe, and the toe pressure being the systolic blood pressure of the toe. So just be aware of that kind of terminology when you're talking to your colleagues, because I'm betting that all of you out there have talked to a colleague or two who have said, oh yeah, I'm going to go do some PPGs. If they were talking to a vascular surgeon, the vascular surgeon would interpret that as, oh, they're going to assess the blood flow of the toe using an infrared instrument. He wouldn't assume that you're doing blood pressures at all. So just be aware of things like that.
So really what I'm going to do is just take a series of samples of your heartbeat, and I'm going to do your blood pressure everywhere. So both of your upper arms, both of your ankles twice, and both big toes. Okay?
Okay, so the reason why we do both arms is because there could be a problem in the upper extremity. It's very rare, but what we are making actually a leaping assumption that the upper extremities are completely normal, and that we can compare a potentially diseased blood pressure at the ankle to that normal artery. In most cases, that's true. There's very little incidence of atherosclerotic disease causing hemodynamic difficulties in the upper extremities. But it can happen, and when it does, what you will see is a decrease in blood pressure from one arm to the other. So you're looking at about a parameter of about 20 millimeters of mercury difference between arms being the kind of the cutoff for normal, abnormal. There is a syndrome called subclavian steal syndrome, and what that is the complete occlusion of usually the left subclavian artery origin. And so that occludes the arterial flow from the aortic arch to the left arm. And what happens is, because of the pressure differences, it will actually pull from the vertebral artery that supplies our blood to the brain. So in that case, you will have a very low blood pressure of the left arm because it's reflecting blood flow that's being retrograde supplied from the brain. At a very low pressure compared to the other arm. Now, I've just got as a little story for you. I had a patient in the vascular clinic who always went and had his blood pressure taken on one arm, always on his right arm, and always on his left arm, I should say. And he came in and I did his blood pressure on his right arm, and it was extremely high. And I asked him about it, and I asked him if he was on any blood pressure medications. He said, no, oh no, the doctor always says that my blood pressure is normal, but he said it is low. And so I did the other arm, and sure enough, it was low. It was about 95 systolic pressure. So the doctor had, in good practice, always done the blood pressure on the left arm, and provided himself a baseline so that he can monitor if his blood pressure is going up too high, and never did a comparison from arm to arm. So in essence, this patient did have subclavian steal syndrome and was treated for stroke after that. So just wanted you to know that it's really important. If you do have a difference between arms and you're not sure, I get a question all the time about if it's just exactly 20 millimeters of mercury difference between arms, does that mean that there is vascular disease on the lower side? And not necessarily. Just be really, really sure that there is a difference of that significance. You may have to do it over, and you may have to really do things to be convinced. I would not take the blood pressures as a standalone. I would definitely ask the patient about their symptoms, and I would ask them and really kind of focus actually on stroke symptoms such as dizziness or weakness in the legs. That's kind of a hallmark for vertebral stroke. But I would also check the Doppler waveforms on that left side. There should be a significant difference in your analysis of the Doppler waveforms from the left to the right, and the lower being probably biphasic or monophasic. So keep those things in mind. If you do have arterial disease of the upper extremities, there's no possible way you can accurately compare the legs to the arms. So really the test is over at that point.